Good morning and a very warm welcome to the second day, ladies and gentlemen, of the 7th NatHealth Annual Summit in technical collaboration with IFC. COVID-19 unleashed an unprecedented health crisis, completely disrupting the ecosystem. Key segments of the healthcare sector like hospitals, diagnostics, medical tourism have been severely affected because of successive lockdowns, dip in footfalls and customer demand, postponement of elective surgeries, and with most hospitals now struggling to functioning as full-time or hybrid COVID facilities while ensuring safety of patients. In addition, there has also been a ripple effect on other industries connected to healthcare, such as those manufacturing, supplying, and providing equipment, medical devices, health insurance, and clinical trial services. As we hopefully come to the end of this pandemic, we are faced at an inflection point in the history of healthcare in the country. Our challenges are multifold, from nursing the sector back to good financial health to plugging the multiple infrastructure gaps that have been laid bare really by the pandemic. The virus was agnostic in its effects in terms of its incidence amongst the rich and the poor of the country, and has only reinforced that universal health coverage is the need of the hour. It is time to reimagine the sector. Digital technologies combined with innovation acumen of Indian manufacturers met all challenges head on, and by catering to the needs of the nation, from vaccines to diagnostic tests. Now, the government is also pulling out all stops to give the much needed shot in the arm to the sector to make India self-reliant in healthcare, as also build a resilient healthcare system and infrastructure accessible and affordable to all citizens. But there are vital questions that need answers. How can private healthcare sector play a greater role today in view of these developments? Can it be a powerful ally in India's aspiration to operate a universal healthcare system supported by an enabling financing, policy, and regulatory framework? NatHealth, in technical collaboration with IFC, seeks to address this and re-emphasize the fact that this is the time to engage, collaborate, and deliberate. The deliberations during the summit, ladies and gentlemen, will offer us many solutions. The NatHealth Summit will pave the way for the synergy and greater alignment amongst various stakeholders towards public-private partnership. We effectively engaged yesterday at the day one of the summit, and today we will delve deeper into other focus areas like long-standing challenges of skilled resources deficit and the need for innovation in infrastructure. So, having said that, ladies and gentlemen, it's time to continue with the dialogue that will help all of us make India strong and healthy. Let us integrate, collaborate, and reimagine. Let me take a moment, ladies and gentlemen, to thank our partners and sponsors, our gold sponsors, Apollo, Medtronic, Mahajan Imaging, silver sponsors, Fortis, Johnson & Johnson, Polymed, and Siemens Healthineers, bronze partners, Terumo, and PD Hinduja Hospital, and our session sponsors, Healthium, Century Super Specialty Hospital, and Capsico. I would like to inform you about the noble initiative by NatHealth with regards to environment conservation. We shall be planting about 10 saplings per speaker featured in the summit, which makes an impressive number of 750 saplings being planted at the end of the summit. We also have a hashtag for this event. I would urge and request you to please spread the message from the summit far and wide using your social media platforms. And there is a hashtag we have, which you would please include. I would request you. Hashtag is NatHealth Annual Summit. Ladies and gentlemen, with that said, I wouldn't gild the lily any further. I would like to straight away now introduce and invite Dr. Ashutosh Raghuvanshi, the Secretary, NatHealth, and Managing Director and CEO of Fortis Healthcare Limited. Now, we all know that Dr. Raghuvanshi is a seasoned healthcare professional with an illustrious career spanning over 27 years. He's a successful and well-recognized, renowned pediatric cardiac surgeon with a proven track record as a successful clinician and an able administrator. He's an acknowledged business and management leader and is known for his strong track record of building successful healthcare organizations while leading great teams, creating structures and processes while delivering exceptional results. Dr. Raghuvanshi, it is such a privilege to have you in our midst, and I'm going to request you, sir, to now not only introduce the first session of the day, which is infrastructure expansion, how can we reimagine health infrastructure development over the next 5 years for India and Bharat, and I will also request you to introduce and invite our keynote speakers thereafter. Dr. Raghuvanshi, all yours.
Thank you, Aishwarya. It is good morning, ladies and gentlemen. It's a great pleasure for me to introduce this important fourth session on the creation of infrastructure in the next 5 years for India and Bharat. I'm honored to welcome Honorable Minister of State for Finance and Corporate Affairs, Shri Anurag Thakurji, several distinguished panelists from government, industry, and also the members of the audience who's present here today to participate in these important discussions. Infrastructure expansion, how can we reimagine health infrastructure development over the next 5 years for India and Bharat is going to be the focus of discussion during this session. The session is lined up with, in the beginning, we will have two keynote addresses by Honorable Minister and by our Secretary of Health, Mr. Dr. Rajesh Bhushan. Post that, we would have two panels which are going to focus on the other elements of the infrastructure care. Ongoing pandemic has highlighted both strengths and weaknesses of our healthcare infrastructure. As we look for the next 5 years, there is a clear recognition of both gaps in urban as well as tier 2, tier 3 cities and the larger hinterland. There are well-documented asymmetries in the existing infrastructure in the different regions of the country, and these need to be addressed as well. For making healthcare truly accessible to achieve the dream of universal coverage. Healthcare delivery does not work in isolation. Therefore, while building infrastructure, the entire ecosystem has to be kept in mind, especially the requirements of human resources. There is a recent study which has been published by NSSO Periodic Labor Force Survey of 2017-18, and that has indicated that instead of 5.8 million health workers as shown in National Health Workforce Account of 2018, the active health workforce could be as low as 3.1 million, as estimated in the NSSO Periodic Labor Force Survey of 2017-18. This is definitely a great cause of concern. Going by the NSSO estimates, the density of human resources for health per 10,000 population is just 16.7, which does not even come close to the absolute minimum WHO threshold of 23 health workers per 10,000 population. There may be a myriad of reasons because of which this happens. It is also because of the migration of healthcare workers abroad and several other factors which contribute to such a shortfall. But this needs to be addressed as we are addressing the healthcare infrastructure needs, because without human resources, the buildings and the equipment is of no use. The healthcare sector is also a major pillar of our economy, and it helps in generating a lot of employment. Several other components such as medical devices, health insurance, preventive and digital healthcare needs also need to be addressed. And in a system like ours and a country as different in different geographies, it is even more important that technology and other areas are also focused on when we are looking at creating an infrastructure for universal health coverage. Nursing, paramedical, and medical colleges attached to the district hospitals to address the human resources constraint could be an important part of development of the healthcare infrastructure. Technology can play a very significant role in improving delivery of care, both in terms of cost as well as quality. Comprehensive health data can help build better systems and continuity of care for chronic ailments, which will definitely improve outcomes significantly. Significant investment in creating the technology framework is going to be an important framework which government has already put a lot of emphasis on in recent times, and that is very encouraging. Things like definition of data standards, interoperability of medical data, health records, creation of universal health records, all these are very, very important steps in the direction. There have been recent developments where certain startups and ITI has come up with a blockchain technology for medical records. So all these components of technology solutions are going to be an important part of the healthcare infrastructure of the country, so that there are no wastages in the system, no slippages, and the outcomes are better. This session has illustrious experts and speakers to touch upon several aspects of the issues surrounding development of infrastructure, both in urban as well as rural areas. I would not like to take further time. Let us start with our esteemed speakers. It is once again a great honor for me to welcome our first keynote speaker, Honorable Minister of State for Finance and Corporate Affairs, Shri Anurag Thakurji. Shri Anurag Thakurji is the fourth term Member of Parliament and he has several achievements to his credit. The young and dynamic minister is not only known for his political wisdom, but also for his championship of sports. He has also served as the president of BCCI. He's a captain in the Territorial Army. He's chief whip in the 16th Lok Sabha. He has been chairman of the several parliamentary standing committees. And one of the most important thing which I feel is relevant is that he's also appointed as a global champion in the category of public health by the Global Fund for creating awareness about malaria, TB, HIV, and AIDS. So it is very heartening for us to have him today as our first keynote speaker for this wonderful session, with both his knowledge of the company affairs, finance, as well as his passion for public health. Let us give it to Mr. Anurag Thakurji for the first keynote address.
Shrimati Preeta Reddy, Dr. Harsh Mahajan, doctors and health professionals. Namaskar. Let me first thank all the COVID warriors for their contribution during the COVID-19 pandemic. I would like to begin by thanking you for the invitation to address the NATHEALTH Federation of India today. I regret I could not join in person owing to some prior commitments. However, I did not want to miss an opportunity to share some of my thoughts and ideas on the issue of health. The COVID-19 pandemic is a turning point in modern history, not just for the world economy, but more importantly for individuals. If the pandemic has taught us anything, it is this: there is nothing more important than health and life itself. It has taught us that good health is not just an attribute of one's physique, but also one's mental outlook. It has exposed our vulnerabilities, it has enhanced our capabilities, and it has expanded our sensibility towards public health. As you are aware, for most of human history, mankind was lucky if we made it beyond 5 years of age. Just 200 years ago, no country had a life expectancy higher than 40 years since the 1800s. The average life expectancy has more than doubled to 72 years plus. The fundamental challenge to which experts and scientists have been trying to find a balance and breakthrough is this: should our goal be to live healthy till we die, or should our goal be to live longer? In other words, should the goal of healthcare be simply to increase human life expectancy, or focus more on solving the health issues we face living each day of our lives? In my opinion, a healthy dose of both is the perfect balance. In fact, they're interdependent. And today, the threats to human life we face are not from microbes, bacteria, and viruses alone, but from our own lifestyle as well. Human technology is bringing us closer to viruses. Factory farming has brought the threat closer too. Climate change, deforestation, and widespread urbanization is changing our boundaries with wildlife more than ever before. This threat is both for the developed and the developing nation. The good part is we understood this long before others. As a civilization, we have lived in harmony and harnessed nature into our lives and food habits. This has ensured resistance and resilience through this global pandemic. You are all doctors and health professionals. You know how brilliantly India has done in fighting the pandemic. Not only are our mortality rates among the lowest in the world, but we have also swiftly ensured the highest vaccine rollout in the world. Not only were we importers of masks and PP kits just a year back, today we are amongst the world's top exporters. Not only are we saving Indian lives, but also following the mantra of Vasudeva Kutumbakam. Vasudeva Kutumbakam. The world is one family, and providing vaccines to over 71 nations of the world. Today, India has made historic strides in public health care. We aim to be the pharmacy of the world. We also aim to provide affordable and accessible healthcare to 1/7 of the humanity. A few years ago, in 2017, we came out with a new national health policy for the country after a gap of 15 years. NHP 2017 addresses the current and emerging challenges necessitated by the changing socio-economic, technological and epidemiological landscape. Modi government has focused on everything, from medical equipments to medicines, from ventilators to vaccines, from scientific research to surveillance infrastructure, from doctors to epidemiologists, so that the country is better prepared for any health disaster in future. Since 2014, we have kept health as a top priority in Modi government. Is it not a fact that even after so many decades of independence, only 6 aims were set up in the country? In 2003, Shri Atalji's government took steps to build 6 more aims. It took 9 years to complete them by 2012. In the past 6 years, the work on 10 new aims has started, many of which have started functioning fully. Beside aims, 20 super speciality hospitals like aims are also being built in the country. The goal is to make available aims at every state, and there must be a medical college between every 3 Lok Sabha constituencies. As a result of these efforts, 31,000 new seats in MBBS and 24,000 new seats in postgraduate have been increased in the last 6 years. I'm happy to say that India is moving towards a major change at the grassroots level in the healthcare sector. We have also provided better health services and facilities to the vulnerable and weaker section of the society through Ayushman Bharat. Under the Ayushman Bharat scheme, work is progressing at a fast pace to build about 1.5 lakh health and wellness centers in the remote areas across the country. So far, 50,000 centers have already started serving. Under this scheme, about 1.5 crore poor in the country, say about 15 million poor in the country, have so far availed free treatment and saved about 30,000 crore rupees under the Ayushman Bharat Yojana. Another savior of the poor is Jan Aushadhi Kendra. About 7,000 Jan Aushadhi Kendras. If I have to be precise, I was present during one of the functions at Simla, where 7,500 Jan Aushadhi Kendra was inaugurated by Prime Minister Modi in the state of Meghalaya. You could see now these Jan Aushadhi centers in the country are providing medicines to the poor at a very low price. Medicine at these Jan Aushadhi centers are cheaper by about 90%. More than 3.5 lakh poor patients are benefiting through Jan Aushadhi centers every day. Due to cheap medicine at these centers, the poor are saving spendings of rupees 3600 crores approximately every year. Now moving on, as a Minister of State for Finance and Corporate Affairs, I am well aware that health financing has been an issue, but not anymore. Despite the shortfall in the central government revenue collection, this year's union budget announced an increase of 137% of the budget outlay for health and well-being, which is to the tune of rupees 2,23,846 crores. We are also supporting states and we have announced 35,000 crore rupees for COVID vaccines already. This year, we continued with our commitments towards health by announcing Pradhan Mantri Atmanirbhar Swasth Bharat Yojana worth rupees 64,180 crores, which will be spent over the next 5 years period. We aim to build a modern ecosystem right from research to testing and treatment in the country itself. This scheme would increase our capabilities in every spectrum. As per the recommendations of the 15th Finance Commission, local bodies will get more than 70,000 crores, keeping health services in mind. That is, the government's emphasis is not only on investment in the healthcare sector, but also to expand the access to healthcare in far-flung areas of the country. We will ensure that these investments not only improve health infrastructure, but also thereby increase employment opportunities in the healthcare sector. As you are aware, there is a huge demand for Indian doctors, Indian nurses, Indian paramedical staff, Indian medicines across the world. Our response during the pandemic has ensured that this will only grow further. I also believe that the world's attention will definitely shift towards India's medical education system, and there will be a huge influx of foreign students to study medicine in India. This will help us not only exchange knowledge, but also expand our healthcare horizons. Moving on, I would like to share two personal initiatives. The first being my long-term engagement on the global fronts, being the global champion for TB, malaria and HIV/AIDS. Over the years, we have brought together various stakeholders to spread awareness through charity matches, flagship campaigns, especially on the issue of tuberculosis. From the union and the state health ministers to top global health experts and organizations, from Indian parliamentarians and legislatures to Bollywood celebrities and cricketers, we have built a strong narrative and accelerated the national campaign titled TB Harega, Desh Jeetega. To achieve the Prime Minister Modi's vision and target of eradicating TB by 2025, 5 years ahead from the world's target of 2030. And next is the second personal initiative, and we call it Aspatal, which are the mobile medical units. We started it in the year 2018 on 14th of April, and we are soon going to complete our 3 years journey. You will be pleased to know that in the last 3 years, we have successfully provided doorstep level medical tests and facilities free of cost. I'm happy to share that Aspatal mobile medical units have directly benefited more than 5 lakh individuals, of which 65% are women beneficiaries. Can you imagine 5 lakh beneficiaries, and out of which 65% are women? Each day these 17 mobile medical units go to a new panchayat. That means we are covering close to 30 to 40 villages every day. And so far, we have covered close to 6,000 villages, more than 800 panchayats, more than 5 lakh people have got free test and medicines through this Aspatal Yojana. As I said, this is my personal pet project aimed at ensuring the best medical services to rural citizens in the hilly state of Himachal Pradesh, from where Dr. Harsh Mahajan also belongs to. Since all of you are experts and doctors, I would be more than happy to engage with everyone and understand how we can expand, improve, and enhance our rural healthcare and rural healthcare infrastructure. And finally, before I conclude, I would like to share a few thoughts and questions for you to ponder over. Can India dream of providing the necessary medical equipment to the world in a cost effective manner? Can we focus on how to make India a global supplier in an affordable and sustainable manner with user friendly technology? Can we build on the pandemic experience of Ayush and impact of traditional medicines on our lives as we go forward? Can we adopt an approach towards becoming a holistic wellness destination and not just affordable treatment? Can we use the expanding footprint of Digital India for telemedicine? If yes, I'll be more than happy to experiment it with my scheme of Aspatal, which is the mobile medical units. Can we think of innovative solutions to fund health infrastructure? Can we identify a few areas where India can become a global leader in the healthcare sector? I look forward to your thoughts on these issues. Feel free to email me and also meet me going forward. I remain open to the new ideas and ways in which government can facilitate the Indian healthcare industry to become a global leader and a force to reckon with. A force to reckon with in the post-pandemic world. With these thoughts, I end and thank you once again for the invitation. Thank you. Jai Hind.
Thank you, Mr. Anurag Thakur. It was indeed a great